Pathmonk is the AI for website conversions. With increasing online competition, over 98% of website visitors don't convert. The ability to successfully show your value proposition and support visitors in their buying journey separates you from the competition online. Pathmonk qualifies and converts leads on your website by figuring out where they are in the buying journey and influencing them in key decision moments with relevant micro experiences like case studies, intro videos, and much more. Stay relevant to your visitors and increase conversions by 50% by adding Pathmark to your website in seconds, by letting the AI do all the work, and increase conversions while you keep doing marketing as usual. Check us out on pathmark.com. Hey everybody, welcome back to Pathmark Presents. Today we are joined by Brian. He's the oculoplastics PA at Amara Medical Aesthetics. Brian, welcome to the show.
Thanks for having me here, Rick.
Of course, excited to have you, Brian. And maybe we get into it. We start with the basics. Tell us a little bit about what's the heart of what Amara Medical Aesthetics does. How would you describe it to someone new? If you were to explain it to a friend over coffee, how would you describe what you do?
Yeah, so Amara Medical Aesthetics is a oculofacial plastics clinic located in Melville, Washington. And what oculoplastics mean essentially is that we just specialize a lot in the eyes and the face. And what's really unique about our clinic is that we kind of have a dual focus. We not only just do advanced cosmetic procedures for people like, eyelid surgeries and things and whatnot, but we also do a lot of like complex medical reconstructive care, which is a very unique aspect because a lot of people are just focused on aesthetics, but don't really realize that when it comes to plastic surgery, there's a lot of medical functional things we can do provide for patients to help them see better or just, feel more confident in who they are in their personal face and who they present in the everyday world kind of thing. It's founded by our surgeon, Dr. Kristen Tarbett. She has a very impressive resume. Not only that she has like over 30 years of experience, but she's triple board certified. She's trained in not only aesthetic surgery, um, facial plastics, but also neuro-ophthalmology, just showing the wide depth of her skill set, but also the breadth of her skill sets that she can not only provide that art of aesthetics, but also, if you need it, provide that medical aspects to really take care of you from your functional aspects of this. So I just find it really impressive, and that's what kind of really drew me to work at Amara Medical Aesthetics when I first graduated, and actually just graduated about 6 months ago from University of
Mm.
Washington. I knew I wanted to work in a field of ophthalmology, focusing a lot on the face and eyes because I just think it's such a huge part of our quality of life. And seeing Dr. Tarbett, her experience and her dual skill set of doing both medical and aesthetics is what really drew me there because as I know that she's someone I can really learn from and really provide services to the full extent of my training.
Of course. I mean, I'm sure
Yeah,
it's interesting to be graduating, and congratulations, by the way, to
appreciate it.
then go under, the mentorship, let's say, of someone with 30 years of experience. I mean, that's a golden ticket right there. Um,
Yeah,
so yeah, that's amazing. I want to touch on your patients, if you will. The people
yeah.
that actually walk in and want to get something done. Now, can you speak to the type of person that's that's essentially working with you guys, and what can they expect when they come and work with you?
Yeah, so oftentimes I'm like typically the first provider a lot of Dr. Tarver's patients sees. And our patients kind of range anywhere from like usually older individuals to middle aged to even younger individuals. Like I've had like some pediatric patients here at our clinic too. It really just depends on what kind of service they're seeking per se. And the reason why they see me first is that I usually conduct the initial pre-ops and just determining if they are a surgical candidate to see Dr. Tarbett essentially. Anything from like our older populations who are having droopy eyelids that's impeding their vision, or a lot of excess skin is kind of going with their eyelids, impeding their vision as well. Or it could be just younger people who are just wanting to refine their look and aesthetic appearance, or younger patients who have congenital issues where they're born with like congenital defects of their eyelids being drooping down, and being able to provide that aspect of fixing that issue for them. And a lot of times too, I kind of just do things on my own, without needing the patient see Dr. Tarbett. Things such as like thyroid eye disease management, so like very complex medical things, to removing skin cancer lesions for testing to see is like cancerous or not, tearing issues, or also even um, addressing like things that's like styes, chalazions, and something I've been kind of growing for my own patient basis is something called dry eye, a dry eye program to really manage a very chronic and debilitating disease that a lot of people have as a standalone disease, but also just from after surgeries, from my eye surgeries or eyelid surgeries, things of that nature.
Gotcha. So these people, obviously, I'm sure, as with other clinics, and speaking to the maybe the experience they've had with you guys, having had surgery and treatment, there's gonna be a lot of word of mouth, right? So if you do your job right, then they'll refer other people, and that's the way it goes. But since this is a marketing podcast, right, we want to focus a little bit on the channels maybe that you use that's outside of the word of mouth. Can you share anything about again, the channels that have become your go-to for bringing in new patients to the clinic?
Yeah, word of mouth is definitely the biggest part of our clinic per se, because it's due to the fact that we get good care. People talked about us. It's the best free marketing. But something we've been really trying to work on a lot is just building a website. Because when it comes to like plastic surgery and facial surgeries, patients really tend to do a lot of research, looking at who the surgeons are at within their areas of region, and really just doing the research to see who fits their ideal intent and goal and end state, but also who can they trust. So building the website to be something approachable and something that's very refined to show that one, we pay attention to the details, and one, we're very present to respond to them to patients fast, to showing that we take pride and care in giving them the full attention of our care, essentially. And another area we're trying to really expand on is something, it's just social media. You can kind of see a lot of like providers doing that on TikTok, Instagram, just doing reels and things of that nature. And that's an area that we're really trying to expand it more into, and just really bringing that, and that usually attracts more of the youthful patient population.
Okay, that's interesting.
Yeah.
So social media, of course, that's gonna be a marketing channel for any business, brick and mortar, digital, doesn't
Hmm.
really matter, right? People are on
Yeah.
social media these days.
Hmm.
But
Yeah.
you did touch on the website. Now, I want to understand a little bit about, how do people, they get to the website. Are they using the website to get in touch with you guys? Do you think they're using it for more research purposes? Understand more about you, about Kristen, how does that work for you? Are you seeing people, or in other words, how did they use the website to essentially become a patient then?
Yeah, they essentially use the patient website one to kind of just look at the credentials of Dr. Tarbit, just really understand who she is as a surgeon and what kind of results she sees. We have a lot of before and after pictures as well, just to really show the results that they can achieve from these surgeries. And also, it's a good way for them to reach out to us as well. We usually get a lot of our website leads, or a lot of our leads of patients from our website. They can send a message directly to our clinic from it to get scheduled, essentially, and just make it very smooth and streamlined process for them.
Okay, I mean that makes a lot of sense.
Yeah.
Um, Brian, maybe we switch gears for a second. I want to talk about you in your
Hmm.
role. Being in the clinic every day. What are the main things you focus on a daily basis? Is there anything specific that you focus on? You mentioned, you're the first person that people see. But give us a glimpse into what a typical workday looks like for you.
Yeah, it's a bit of a work day, kind of like I come in very early in the morning, like, well, not super early, I guess, but 9 a.m. and just really prepping my charts, kind of looking at what kind of patients I'm seeing today, what they're here for, seeing if they are a website lead, or if there's somebody who is a medical referral from another doctor. Usually, once a medical referral from another doctor, you can kind of easily tell what's going to be coming your door, because typically the doctor has already written a huge amount of notes about what they're here to see you for. But on website lead, you kind of have to really prepare more mentally about what they could possibly be here for. Is it like more of a cosmetic thing? Is it a functional medical aspect they're concerned about? So just really just trying to like really look into the situation. And from there, I just kind of see a lot of patients, and anywhere from surgical pre-ops to just managing dry eye on an usual basis, or doing procedures such as like injections or using laser treatments and radiofrequency treatments for our patients to really relieve their dry eye symptoms. Or it could be very complex medical, like thyroid eye disease, and where you have a very extensive medical workup to really um, seeing if they are a candidate for a new drug on the FDA market called Tepezza to really treat a very debilitating disease. And then usually after the end of the day, it's a lot of like admin work, making sure that patients are getting prescriptions, getting prior authorizations to get approvals. And then also when I do have free time, find out ways to really build our dry eye program or find ways to market more. So I'm kind of working with our front desk staff to find ways to make new TikTok content essentially.
Gotcha. I'm sure that's
Yeah.
that's an interesting time because sometimes
Yeah.
I don't know, I haven't seen you guys' TikTok, but you want to keep it engaging. Of course, people you're competing with not only your competitors as such, but also with everything else that's going on social media.
Yeah.
So you've got to be creative with something. Is there something that you recently did that was kind of like fun to do, or just give us an idea of the type of content that you guys are posting?
Typically, we are currently a lot in the brainstorming phase right now. And right now, we're mostly filming with our providers like Dr. Tarbid and one of our nurse injectors here as well, Natalia. They've been here for a long time. Me being new, I'm still trying to like help brainstorm the ideas right now. But we're just kind of building ideas of what kind of things I can do. Like I'm just like watching a lot of different TikToks from like just like Dr. Yoon and stuff like that, all these other plastic surgeons and kind of seeing their ideas and seeing the trends that are kind of going around um, in the social media aspects right now.
Mhm.
So I haven't really have like a strong idea of what we've recently done yet, but like it's just something we're kind of brainstorming, kind of going more towards in as of lately.
Gotcha. Okay.
Yeah.
So,
Mhm.
Brian, we're going into the back half of our time together here. So, as before we wrap things up, I'd love us to go through our rapid fire segment, which is essentially, just a few questions to keep things light and engaging, and it's just rapid fire style. Are you ready for it?
Yeah, for sure.
All right. So, when it comes to consuming content, now we were talking about TikTok. Do you prefer watching, reading, or listening?
I prefer watching, definitely. It's just more engaging to
Gotcha.
me. I'm a very visual person.
Makes sense. So,
Mhm.
what's the latest piece of content that you watched? It could be a YouTube video, it could be a movie even, right? That you picked up. Were there any ideas or gems that really stuck with you in it?
Definitely mostly like I would say just videos just through TikTok, Instagram, and then if outside that content, typically a lot of like YouTube is what I watch. Just more for educational aspects, informational stuff. But a lot of the stuff I do for leisure is definitely through TikTok and Instagram. It's just the reels are just fast, engaging, quick, kind of like it doesn't really drain your attention span too much as it is in my generation per se. So I watch a lot of videos of just like yeah, just a lot of things trending on Instagram and TikTok. Like searches would do like these kind of funny like trends of like I can't think of anything on top of my head. Um, Getting a little uh brain fart at the moment. I apologize.
That's no worries.
Yeah, yeah. But a lot of things are trending online essentially, and it just kind of goes so fast through all the trends. It's kind of hard to pinpoint an exact area that people are, things I'm kind of particularly watching per se.
Yeah, no, I think you're right, and it speaks to the volume of content that's out there, right? That's
Yeah,
you watch things and it might entertain you for a little bit, and that's what I was talking about when you talk, when you say you're competing against everything out there, right? When you're on TikTok,
yeah,
of course, there are niches, and you guys, in the medical space, I'm sure there's something specific about it, but
yeah.
man, it's really a
Oh,
jungle out
yeah.
there. So
Yeah, there's like one like I was like talking about just watching recently is about like when people like do exercising or lifting hard because I'm a huge like person into fitness and stuff like that. I lift a lot quite often, and one of the things we do in like aesthetic surgery is that whenever you frown a lot and you make these like strong facial expressions, that's how you kind of create your wrinkles. So some trend I've been seeing is people like when they're lifting they kind of keep like a very neutral, nonchalant face essentially to, oh, that's how I prevent my wrinkles and things like that nature. And I kind of found that's something that relates to our field, but also something I do a lot, like fitness and things like that.
That's funny. I mean,
Yeah.
I don't know if that's what they're thinking at the moment. I don't want to wrinkle or anything, but it's a
Yeah.
good, it's a good way to kind of cross it over to your field, right? Just
Yeah.
keep a straight face, and also helps with, I'm sure, the breathing, and kind of
Yeah.
goes more
Mhm.
into the meditative side of lifting, if you will, or exercising,
Yeah.
which is pretty interesting.
Yeah, so it's just something I've just been seeing more lately in the social media aspects, and I just found it funny because then I lift a lot, and it's something I personally have always been trying to do too, like just try not to strain my face so much because I know that's gonna affect my wrinkles in the future, and you want to have that kind of that neutral, like kind of like a Botox frozen face in a way.
Right.
When you lift, it just looks kind of like ridiculous and funny. So
I'll try that. I'll try that for sure.
yeah,
So,
yeah.
Brian, if you had a magic wand and you could fix one frustrating thing in your life with tech, what would it be?
Just more. I mean, just really learning how to leverage AI to just automate a lot of things in my life, like the admin roles and admin aspects of I think, both the marketing aspects of how we can improve our marketing through automation of it, but also just the administrative burden of medicine. It's a lot of like charting and just keeping records of all the patient encounters we have. And I think it's just a huge aspect of my life that takes a lot of time. And I think if I can learn how to leverage AI to do those things without the red tape of HIPAA and like medical personal information, that's something an area I would really like to get the technology very high up to
Mm,
kind of automate my life more, just to make myself more efficient, focus more on patient care, and focus on other ventures outside of just doing the administrative burden of medicine.
right. Okay.
Yeah.
Maybe this is related, maybe not, but my next question was going to be about mundane tasks, right? So, is there any task that you'd like to put on autopilot forever between the things that you do on a daily basis?
Yeah, I'd love to be able to just like walk into a patient room and just talk to patient, do my exam, and some kind of magic computer or magic wand does keeps a record of everything I've done and completely knows what I'm about to say next, and just kind of immediately logs it down for me. So by the time I leave the room, everything's all perfectly charted. So that way I continue to see more patients. And if I have more time, think about ways to expand our business, think about ways to find new marketing strategies and new ideas, and more time to film more TikToks or, more time to do all these other things to bring in more patients and not be so focused on these mundane tasks that, that's really taking up a bulk of my time.
Okay. Um,
Yeah.
I can see that, just like a super intelligent computer it's kind
Yeah.
of scary though in a way, that listens to everything. I'm just thinking out loud as I'm saying it.
Yeah.
And, in a way we live in a society that's already happening, but
Yeah.
do you want a computer to listen to everything? Do you know what I mean?
Yeah, I think it's like a double-edged sword, like it can listen to everything. And what if, like that computer just uses it against you, or like
Right.
just really it really kind of breaks that barrier of privacy for a lot of times, and like you don't really know like when it's acting on its own. Like, sometimes, AI has like its own agency per se. And what if it's
Mhm.
just listening on its own and without informing you? And who knows what tech can grow into and what kind of things can occur.
Right, right. We don't want
Yeah.
to get
Mhm.
into the sci-fi realm
Yeah.
here, but
Yeah. Mhm.
so Brian, again, I want to thank you for being on the show with us today. I also want to give you the last word before we wrap everything up. If someone forgets everything about the interview today, Brian, what is the one thing that you should remember about the work you guys are doing at Amara Medical Aesthetics?
Yeah, the work we do at Amara, I would say, is that we provide the utmost care and time and attention, and not just in the art of medicine, of aesthetics, but also remembering the complex medical things so that you never know when things go wrong in your treatments. And then just know that Amara is able to take care of that and address it from start to finish, and whether you have any complex complications. And that's because just the breadth of our skill sets of not just only doing aesthetics, but also the medical reconstructive side.
All right. Thanks for sharing that, Ryan. And if someone wants to check you guys out, maybe they want to become a patient, or see what type of work you do, where could they go?
Where they can go is let me pull up the website really quick. Mar- So the website will be at amaraestheticsbellevue.com, and that'll be the best place to one look to see what we provide and what our credentials are, and also as a way to reach out to us as well.
Amazing. Thanks
Yeah.
again for that, Brian. And it was a very insightful conversation about, understanding how you work and your, you're just starting out in a way in the clinic after graduating, and you're already, full of knowledge and, looking at how you can grow the business. That's something that really caught my attention. So again, thank you for sharing that with us, and I wish you a wonderful day.
All right. Thanks, Rick. Thanks for having me here, and hope you have a great day too as well.
All right. Bye, everyone.
All right. Bye.